experts here, and now I'll focus with to you, Beth. Can you tell us what are some of the early signs and symptoms that one can be on the lookout for?
Okay, I'll start by saying this, that usually breast cancer, you don't feel any pain if it's the first stages.
Okay.
I'll start by saying that. So that's why Breast Cancer Care Foundation always emphasizes that if you see any abnormal on your breast, please come to the clinic.
Okay.
That's why we always say you have to do self-breast examinations. And that's why we're there as Breast Cancer Care Foundation, going out there, spreading the awareness. We're on social media always. We're opening our clinics. We also have walks around the communities, just spreading about breast cancer.
Mm-hmm.
So the signs and symptoms that someone can look out for, usually during their self-breast examination, is one, the lump that we talked about.
Mm-hmm.
So as those are the ones you feel. And then secondly, as Tabitha explained, you're looking for the skin changes around the breast area. As she said, you have skin discoloration,
Okay.
you have inverted nipples, your nipples either leak milk or any fluid blood when you're not even breastfeeding. And then the skin dimpling and skin wrinkling as well. So those are the signs. We call them the 5 critical signs and symptoms of breast cancer. So
Okay.
those are the ones that someone can look out for. So every month we encourage that every woman must do self-breast examination. If you see anything that is abnormal from the normal you know about your breast, please go to the clinic.
That's very helpful to know. I'm talking now at a personal level. The lump is always the one that we are looking forward to, saying if I feel anything, but as we heard, that's at an advanced stage. Yeah, so it's all of the signs that are being mentioned here by our experts are very important to pay attention to. What are some of the things, Tabitha, that you'd want women to pay attention to as regards their bodies in relation to breast cancer?
So as Beverly said, it's so important to know you're normal.
Okay.
So what we're doing is we're putting our hands behind our head. We're looking in the mirror because, as Beverly said, a lot of the things to look out for are visual.
Okay.
It's not just feeling, it's actually looking. And the first time that we do it, we're going to feel lumps and bumps, and so the top part is quite grainy, and so
The granulars that you
yes.
can feel as you palpate.
And you're like,
Yeah.
oh, there's
Something
loads
is
of lumps.
happening.
There's so many, right? And then in the middle section, it's very squishy, and you're sort of like, oh, I don't know if I can feel anything or not. And then underneath, it's sandy, you know, so further underneath. And this is actually normal. But what we always say, all of our services are totally free.
Wow.
We are open every Wednesday and every Friday at the Dream Centre.
Okay.
So come and just ask the questions. Come and get your scan. We say, most of the time, we say, okay, that's normal. So then when you check yourself next month, those lumps and bumps that were scary, we go, oh no, that's my normal. Okay.
Okay.
And when we're checking ourselves every single month, if we menstruate, we're doing it a week after our periods. If we don't menstruate, we're picking a day, the first of every single month. And that is when we are checking our breasts so that we know when something new or something unusual for our body comes up. And then you come and see Breast Cancer Care Foundation at our clinic any Wednesday, any Friday, and we do the ultrasound scan. And there is no harm in just coming. Don't feel scared. Don't feel like you're wasting anyone's time. Don't be afraid to check yourself.
Okay.
And it's so important to be doing it every single month, because that's when you notice differences. And if you've noticed them, the changes, and if you've noticed them early, you come early, you get checked early, and if there's anything, it gets treated early, and you have a very, very high chance of living a normal, healthy life.
Exactly.
And if it's nothing, then great, you haven't lost anything.
That's so true. Let me just ask you, Tabitha, and I'll speak from a personal experience where there was a campaign, breast cancer screening, that I had to go to a certain clinic, I will withhold the name. And after the screening, I was told there's a lump in your breast. Trust me, I couldn't sleep for several days. What I chose to do is to go to another place for a second opinion. And I had several tests after that, and that was actually cleared off. How many times do you get clients or individuals coming to you after they've already screened elsewhere and they just want to validate or for a second opinion?
A lot of times.
Okay.
A lot of times, yeah. And it's great. We really welcome that, don't we?
Yeah.
Because we want to have the dialogue. We're not just a medical clinic. We provide awareness, we provide group counselling, we provide survivorship, culture and care. We provide follow-up for other institutions actually. So
great.
for us, the dialogue is also the important part. When you go out and you do workshops with people, our favourite part is the questions and answers. Because then we get an understanding of where people's knowledge and fears are, and then we are able to kind of help with that and advise.
That's
and
very helpful.
as women, I feel like we should be doing that always, not just in a medical setting.
Exactly.
So being able to open up the dialogue is the important thing for us.
All right, in this segment, we want to look into statistics. And I'm going to call upon you, Tabitha and Beth, to now give us more in zoning in what it looks like for Malawi. But I've got 4 facts here that presents the data worldwide. And the first is that 2.3 million women are diagnosed with breast cancer globally from 2022. From the same period, we have had 670 deaths, obviously still counting, but at the point of where the data was produced, and that's alarming. Another data statistics is that most common cancer in women in 157 out of the 185 countries. That's also an alarming data. And the last one is that 99% of the cases occur in 0.5 to 1%. Sorry, I'll take that back. 99% of the cases occur in women, while 0.5 to 1% occur in men. So here, because of the theme and the month, breast cancer, but we're looking at 99 cases of cancer worldwide being in women. Tabitha, I'll start with you. Can you just tell us what it looks like for Malawi through your experience working on breast cancer?
Well, thanks for bringing up those statistics, because essentially what that translates into is 1 in 8 people, women, are diagnosed with breast cancer. Breast cancer actually accounts for over 30% of all cancers.
Oh,
All the possible cancers that there are in the world,
okay.
breast cancer accounts for over
30%.
30%. It's the most common form of cancer all
Overall,
round,
Okay.
And it is the most common form of cancer death. It's exactly what you said. So it's a really big deal. And yet in Malawi, most people we see don't know about breast cancer.
Exactly.
They don't know it exists. They don't know to check themselves. They don't know how to check themselves. They don't know where to go if there is an issue. There's no information about what treatment options there are. So this is a crisis. This isn't a critical time. It's an actual crisis.
Okay.
It's a health crisis. And you also mentioned about how in the 157 of the 185,
Yes.
but going back to research, it's actually not representative of countries who just haven't yet done the research. So it's not that there isn't breast cancer in Malawi, as we know, it's just that there's no information about breast cancer in Malawi. So we're not kind of being represented on the worldwide platform of research statistics and understanding and information about breast cancer in our country compared with the rest of the world. So we can only speak from our clinic. We have been able to screen nearly 7,000 people in 4 years.
97.
7,000.
7,000, okay.
In 4 years.
Okay.
And 3,000 of those people are out in rural areas. So we have a pretty decent database.
Exactly.
And what our data shows is that about 10% of the people that we see are in need of further medical care. Now, that doesn't always mean cancer, but this means something that has put the red light on, and that means fibroadenoma, cysts, lipoma, abscess. Now, these are all things that need to be continued to follow up. These are all things that need to be kept an eye on. And then we have found the average age of people needing further medical care is 36.8 years old, which is very low compared to the worldwide statistics.
Exactly.
So in Malawi, we have a great need to put some urgency on raising awareness, explaining how to do self-breast examination, and this is key because then people come forward early, then they are able to get checked, then they're able to go and get biopsies, and they're able to get treatment, and then there is a likelihood of having a happy, healthy, normal life post-diagnosis.
Very possible.
So this is why it's essential for us to raise awareness, because then people will be able to get treated and live life.
And what you're presenting, Tabitha, I'm just looking at us as Malawi Liverpool Walk-On Program, being a medical research institute. I mean, clearly there's that gap, and in just how many people can come forward, just do more research that's going to validate and expose all this information. Because as you said, you're just speaking from a subset of clients or patients that you're seeing. But there is that clear gap that we really need to address as a nation. Look like on the research horizon, anything that you know that's ongoing in Malawi that may not be related to Breast Cancer Care Foundation, but just any information on insights on research going on cancer that we have to let the public know of.
Yeah. There has been pilot programs, there's been different discussions about it. There was a useful project called the 𝑦𝒗𝒆𝒓𝒚 project that did do a pilot to be able to teach clinical breast examination. That started a couple of years ago. It was ongoing until last year, because we're highlighting here that there was no training for clinical breast examination. So we were able to support that by having discussions with the survivors that had come through our clinic, and with different community outreach ideas. So that is in progress, definitely. I'm not overly aware of any other particular breast cancer research, and particularly in the research section. I know that there are some amazing professionals in the medical field that really do want to do this. But as we know, there is not a lot of funding. The country's gone through a massive economic crisis, and to be frank, women's health is not a priority.